ਸਤਿ ਸ਼੍ਰੀ ਅਕਾਲ ਵਰਲਡ ਨਿਊਜ਼ ਦੇਖ ਰਹੇ ਦੇਸ਼ ਵਿਦੇਸ਼ ਦੇ ਸਾਰੇ ਦਰਸ਼ਕਾਂ ਦਾ ਸਵਾਗਤ। ਮੈਂ ਤੁਹਾਡਾ ਨਾਲ ਰਮਨ ਬਾਜਵਾ। ਖਬਰਾਂ ਦਾ ਆਗਾਜ਼ ਕਰਾਂਗੇ ਪਰ ਸਭ ਤੋਂ ਪਹਿਲਾਂ ਇੱਕ ਨਜ਼ਰ ਹੁਣ ਤੱਕ ਦੀਆਂ ਹੈਡਲਾਈਨਸ ਤੇ। ਫੈਡਰਲ ਚੋਣਾਂ ਲਈ ਹੁਣ ਕੁਝ ਹੀ ਦਿਨਾਂ ਦਾ ਸਮਾਂ ਬਾਕੀ। ਪ੍ਰਧਾਨ ਮੰਤਰੀ ਜਸਟਿਨ ਟਰੂਡੋ ਵੱਲੋਂ ਚੋਣ ਪ੍ਰਚਾਰ ਵਿੱਚ ਲਿਆਂਦੀ ਗਈ ਤੇਜ਼ੀ। ਫੈਡਰਲ ਚੋਣਾਂ ਵਿੱਚ ਪਾਰਟੀ ਦੀ ਮਜ਼ਬੂਤ ਦਾਅਵੇਦਾਰੀ ਕੀਤੀ ਪੇਸ਼। ਕੈਨੇਡਾ ਵਿੱਚ ਕੋਵਿਡ-19 ਦਾ ਕਹਿਰ ਜਾਰੀ। ਕੇਸਾਂ ਦੀ ਗਿਣਤੀ 1.55 ਮਿਲੀਅਨ ਤੋਂ ਹੋਈ ਪਾਰ। ਵੈਨਕੂਵਰ ਦੇ ਵਾਟਰਫਰੰਟ ਖੇਤਰ ਵਿੱਚ ਬੁੱਧਵਾਰ ਨੂੰ ਇੱਕ ਹੋਟਲ ਵਿੱਚ ਗੋਲੀ ਲੱਗਣ ਨਾਲ ਇੱਕ ਵਿਅਕਤੀ ਦੀ ਮੌਤ। ਘਟਨਾ ਤੋਂ ਬਾਅਦ ਸ਼ੱਕੀ ਵਿਅਕਤੀ ਫਰਾਰ। ਤੇ ਤਾਲਿਬਾਨ ਨੂੰ ਅੱਤਵਾਦੀ ਸੰਗਠਨ ਕਰਾਰ ਦੇਣ ਦੀ ਉੱਠੀ ਮੰਗ। ਯੂਐਸ ਸੰਸਦ ਮੈਂਬਰਾਂ ਨੇ ਵਿਦੇਸ਼ ਮੰਤਰੀ ਨੂੰ ਲਿਖੀ ਚਿੱਠੀ। ਤਾਂ ਬੁਲੇਟਿਨ ਦੇ ਆਗਾਜ਼ ਵਿੱਚ ਸਭ ਤੋਂ ਪਹਿਲਾਂ ਗੱਲ ਕਰਦੇ ਹਾਂ ਕੈਨੇਡਾ ਵਿੱਚ ਹੋਣ ਜਾ ਰਹੀਆਂ ਫੈਡਰਲ ਚੋਣਾਂ ਦੀ, ਜਿਸ ਨੂੰ ਕੁਝ ਹੀ ਸਮਾਂ ਬਾਕੀ ਰਹਿ ਗਿਆ ਤੇ ਅਜਿਹੇ ਵਿੱਚ ਜਸਟਿਨ ਟਰੂਡੋ ਵੱਲੋਂ ਚੋਣ ਪ੍ਰਚਾਰ ਵਿੱਚ ਹੋਰ ਵੀ ਤੇਜ਼ੀ ਲਿਆਤੀ ਗਈ ਹੈ। ਉਨ੍ਹਾਂ ਕਿਹਾ ਕਿ ਸਾਡੀ ਸਰਕਾਰ ਅਸਲ ਮਾਇਨੇ ਵਿੱਚ ਲੋਕਾਂ ਦੀ ਭਲਾਈ ਲਈ ਕੰਮ ਕਰਦੀ ਹੈ, ਜਦਕਿ ਦੂਜੀ ਪਾਰਟੀਆਂ ਸਿਰਫ ਵਾਅਦੇ ਕਰਨਾ ਹੀ ਜਾਣਦੀਆਂ ਨੇ। ਇਸ ਮੌਕੇ ਉਨ੍ਹਾਂ ਜਗਮੀਤ ਸਿੰਘ ਅਤੇ ਐਰਿਨ ਓਟੂਲ ਉੱਤੇ ਵੀ ਬਿਆਨਬਾਜ਼ੀ ਕੀਤੀ ਹੈ।
Well, I think Canadians are seeing that there are very different ideas about how to end this pandemic, how to move forward on climate change, on childcare, on housing. And Canadians deserve a choice because those decisions are going to be taken by the government now, in the coming weeks, not a year from now, not 2 years from now. And that's the choice Canadians get to make. The only thing putting childcare in jeopardy is Erin O'Toole's desire to turn it back, to rip up deals that give Canadians. I know Canadians want childcare not just for their families, but for jobs, for economic growth, for businesses who've said, you're right, this pandemic has taught us affordable childcare is an economic policy. Mr. O'Toole's making the wrong choice, and Canadians have the opportunity to show that. I think Canadians have seen that over the past 6 years, not only did we create 1 million jobs, but we lifted 1 million people out of poverty. We've moved forward on ending 116 boil water advisories and have a plan to end all of them in the coming months and year. We promised big things and we've delivered big things, but yes, there is more to do, and that's why the choice of whether we go stronger on fighting against racism and intolerance when a Conservative platform didn't even mention the word racism, the choice becomes clear. I will not take off the table, unlike the other leaders, including Jagmeet Singh. I don't think a government should be telling a woman what she should or should not wear. That's not something that we want to. We have not taken off the table challenging at one point. I've been saying that for years because a federal government always needs to stand up for people's fundamental rights, and Quebecers know that. I commit to continuing to doing more. What we have done over the past years is bring in far more diversity into the Prime Minister's office than ever before, into Cabinet. We're going to continue to make sure that we're the party that not just upholds diversity in Canada, but embodies it. Talked many times about different things that we learned during the pandemic and different things that will move forward. We learned on the scramble on PPE that we had to go even more aggressively, and we did on vaccinations, and now we're leading the world. Even as Canadians continue to need to get vaccinated to get through this, I'll be unequivocal on that one. That's one of the things we learned, to trust science as we move forward, and we're doing that.
ਉਧਰ ਗੱਲ ਕਰੀਏ ਕੈਨੇਡਾ ਵਿੱਚ ਕਰੋਨਾ ਕੇਸਾਂ ਦੀ, ਜਿਸ ਵਿੱਚ ਲਗਾਤਾਰ ਇਜ਼ਾਫਾ ਹੁੰਦਾ ਨਜ਼ਰ ਆ ਰਿਹਾ ਹੈ। ਨਿਊ ਬਰਨਸਵਿਕ ਦੇ ਵਿੱਚ ਇੱਕ ਦਿਨ ਦੇ ਅੰਦਰ ਲਗਭਗ 63 ਨਵੇਂ ਕਰੋਨਾ ਕੇਸ ਰਿਪੋਰਟ ਕੀਤੇ ਗਏ ਨੇ।
87% have the first dose. If we had that double dose, we wouldn't be in this situation. We're trying to recognize those that have gone forward, got vaccinated, and are making their, doing their part, and saying, let's try to hold on to the freedom we have. But you're right. A week from now, we may have to go deeper. Well, we certainly have identified, as we have in the past, contact tracing is a big part of what we were able to achieve during the entire pandemic, and we're still doing that to the same level of same degree. Now, we recognize the variant's different, and we've identified the sources, and we've also identified the age categories. 50 and up, we're at about 90% vaccinated. Right. 15 down, it's about 65%. Well, is it going to blunt it, or is it going to create a significant imposition on businesses trying to stay open, on lifestyles that people have been accustomed to? And we're doing our part in the schools. We're masking in our schools. So we think we can continue to contain this, but every day is a new day for sure. Increased case count was predictable. We said that during the opening, but no, to the level that I guess we thought the vaccinations would achieve over the coming weeks after following July 31st. We expected to be at 75-80% long before we were. Because it did slow down after we announced the opening, and it slowed down through August. So now we're trying to say, well, let's get that up. And so, yeah, could it have been different? Would it have been different? But I mean, probably not, because with the facts I had available to me at the time, I would do the very same thing as we did all through the pandemic. But I was also cognizant of how do we get people's lives back in order at the same time as manage the pandemic. And, Steve, the difference is the solution is right in front of us. Vaccines are available in Canada, in New Brunswick, and around the world. They're crying for vaccines, and here we can't get people to take them. How far do we go? We put the restrictions on activities, and we're willing to continue to tighten those restrictions.
बेशक कैनेडा विच वैक्सीनेशन वड्डे पद्धर उत्ते जारी है, पर अजे भी इसका प्रभाव घट होने का नाम नहीं ले रहा। कैनेडा सरकार ने कोविड के ताज़ा अंकड़े संबंधी रिपोर्ट जारी की है, जिस मुताबिक हर रोज औसतन 4300 नवे केस सामने आ रहे हैं। डॉक्टर थैरसा ने सरकार वालों लोगों को जागरूक करने लई वड्डे पद्धर उत्ते कोशिशां करन दी भी गल कही है।
Unless we can quickly reduce overall transmission rates through accelerated vaccination and other measures where the virus is surging, continued expansion of the epidemic could lead to higher case counts than we have experienced thus far. Likewise, we're still close to 7 million eligible people not yet fully vaccinated amid predominance of the highly contagious and more severe Delta variant. Hospitalizations could exceed healthcare capacity in impacted areas. Nationally, the average number of daily new cases reported is now over 4,300. On average, almost 1,950 people with COVID-19 are being treated in our hospitals each day, including over 650 in intensive care units, and an average of 25 deaths are being reported daily. Reported cases and severe illness are predominantly occurring among unvaccinated people. During the month of August, the average weekly rate of new COVID-19 cases was 11 times higher, while the average weekly rate of hospitalizations was 39 times higher in unvaccinated people than in fully vaccinated people. Increasing the vaccination rate overall and raising fully vaccinated coverage among young adults aged 18 to 39 years in particular could slow epidemic growth enough to reduce the risk of exceeding healthcare capacity or shorten the duration of seriously elevated hospitalization rates through the winter. Rapidly achieving these gains could also lessen the need for more stringent measures to control activity if and when healthcare capacity is threatened.
मैनिटोबा विच फर्स्ट नेशन के लोगों वालों अपने भाईचारे नूं जागरूक करने लई आवाज़ बुलंद की जा रही है। उन्होंने सब नूं कहा कि 20 सितंबर नूं वोट करने लई सब अगे आउण तां जो एक चंगी सरकार की चोण की जा सके। दी असैम्बली ऑफ मैनिटोबा चीफ के आगू अलेन दुमास ने कहा कि फर्स्ट नेशन के लोगों नूं बनदे हक नहीं मिल रहे।
Everybody has to vote. That's the only way that governments and democracy works. Democracy only works when the people are engaged. You have to stand up and get engaged. You have to tune in. You have to pay attention. I know it gets cumbersome. And I know some feel that change doesn't happen quick enough. But we need you to continue to push forward, regardless. We have to continue to push forward and be examples for the rest of the country.
One thing that I want to encourage all political parties, there's many things. I can list you so many things. But one of it for Manitoba First Nations for sure is the connectivity, connecting our communities to the internet. And I hear time and time again, every time I talk to different communities, they don't have it, or it's slow, or there's so much stuff that we need. But one of them is connectivity.
If we don't vote, the status quo will stay the same. We will not see change until we see that our people's voice are included in these elections. And I want to remind our relatives, get out there and vote. Like they always tell us, if you don't vote, you can't complain. And I believe that.
ਚੋਣਾਂ ਦੇ ਦਿਨ ਬਿਲਕੁਲ ਨੇੜੇ ਨੇ, ਪਰ ਦੂਜੇ ਪਾਸੇ ਐਨਡੀਪੀ ਪਾਰਟੀ ਮੁਸ਼ਕਲਾਂ ਵਿੱਚ ਘਿਰ ਚੁੱਕੀ ਹੈ। ऑनलाइन टिप्पणियां कारण पार्टी के 2 उम्मीदवार काफी सुर्खियां विच रहे, जिस कारण उन्होंने अपने अहुदे तो अस्तीफा भी देना पिया। इन तमाम सवालों का जवाब पार्टी प्रधान सरदार जगमीत सिंह ने किवें दिता है, जरा तुसीं भी सुनो।
Yeah, this was a mistake, and I think they made the right decision. We have one society where no one is faced with discrimination. Anti-Semitism is impacting people in a really profound and serious way, and we're seeing a rise in hate. And so we've got to be very vigilant. And this was a mistake, and I'm glad that it was fixed. Not at all. I mean, we are fighting for people, and every single day in this pandemic, we fought to get more help to more people. We fought to double the CERB. We fought to bring in a higher wage subsidy. And the reality is, on the things that matter to people in this pandemic, long-term care and the people that live there were the hardest hit. People lost their lives, and we said we should remove profit from long-term care. The reality is, Mr. Trudeau teamed up with Mr. O'Toole to vote against getting the profit or the greed out of long-term care. We believe that medication coverage should be there for workers, for everyone. And when we brought forward a bill on pharmacare, Mr. Trudeau teamed up with Mr. O'Toole to vote against it. And we said that in this pandemic, everyday folks struggled. But the super wealthy, the billionaires and the multimillionaires and those who use offshore tax havens were able to increase their wealth. We said we should make the billionaires pay their fair share. Mr. Trudeau teamed up with Mr. O'Toole to vote against taxing the super rich. So on those really important things about who pays for this pandemic and how do we get through this and how do we invest in healthcare, both Mr. Trudeau and Mr. O'Toole, both the Liberals and the Conservatives, teamed up to hurt people. And I want to make that clear to Canadians. They've got a choice in this election. Mr. Trudeau, who says a lot of things but is all for show and protects the super rich, or you Democrats who fight for you. We're going to make sure the billionaires pay their fair share, make sure we invest in our healthcare, and I want Canadians to know that.
ਕੈਨੇਡਾ ਵਿੱਚ ਬ੍ਰਿਟਿਸ਼ ਕੋਲੰਬੀਆ ਦੇ ਵੈਨਕੂਵਰ ਸ਼ਹਿਰ ਦੇ ਡਾਊਨਟਾਊਨ ਕੋਰ ਦੇ ਵਾਟਰਫਰੰਟ ਖੇਤਰ ਵਿੱਚ ਬੁੱਧਵਾਰ ਨੂੰ ਇੱਕ ਹੋਟਲ ਵਿੱਚ ਇੱਕ ਵਿਅਕਤੀ ਨੂੰ ਗੋਲੀ ਮਾਰ ਦਿੱਤੀ ਗਈ। ਇਸ ਘਾਤਕ ਗੋਲੀਬਾਰੀ ਦੀ ਜਾਂਚ ਲਈ ਵੈਨਕੂਵਰ ਪੁਲਿਸ ਨੂੰ ਬੁਲਾਇਆ ਗਿਆ। ਪੁਲਿਸ ਨੇ ਦੱਸਿਆ ਕਿ ਕੈਨੇਡਾ ਪਲੇਸ ਦੇ ਨੇੜੇ ਫੇਅਰਮੌਂਟ ਪੈਸੀਫਿਕ ਰਿਮ ਹੋਟਲ ਦੀ ਪਾਰਕਿੰਗ ਵਿੱਚ ਸ਼ਾਮ ਕਰੀਬ 3:30 ਵਜੇ ਦੇ ਕਰੀਬ ਇੱਕ ਵਿਅਕਤੀ ਬੇਹੋਸ਼ ਪਾਇਆ ਗਿਆ। ਇਸ ਵਿਅਕਤੀ ਨੂੰ ਗੋਲੀ ਲੱਗੀ ਸੀ। ਮਗਰੋਂ ਤੁਰੰਤ ਉਸ ਨੂੰ ਮੈਡੀਕਲ ਟੀਮ ਬੁਲਾਈ ਗਈ ਤੇ ਮੌਕੇ ਤੇ ਪਹੁੰਚੇ ਪੈਰਾਮੈਡਿਕਸ ਨੇ ਘਟਨਾ ਸਥਾਨ ਤੇ ਵਿਅਕਤੀ ਨੂੰ ਮ੍ਰਿਤਕ ਐਲਾਨ ਦਿੱਤਾ। ਫੋਰੈਂਸਿਕ ਮਾਹਿਰ ਅਤੇ ਵੀਪੀ ਦੀ ਗੈਂਗ ਯੂਨਿਟ ਦੇ ਮੈਂਬਰ ਘਟਨਾ ਸਥਾਨ ਤੇ ਮੌਜੂਦ ਨੇ। ਅਧਿਕਾਰੀ ਪਾਰਕਿੰਗ ਤੋਂ ਬਾਹਰ ਨਿਕਲਣ ਵਾਲੀ ਸਾਰੀ ਗੱਡੀਆਂ ਦੀ ਜਾਂਚ ਕਰ ਰਹੇ ਨੇ। ਪੁਲਿਸ ਦਾ ਕਹਿਣਾ ਹੈ ਕਿ ਉਹਨਾਂ ਦਾ ਮੰਨਣਾ ਹੈ ਕਿ ਗੋਲੀਬਾਰੀ ਵਿਅਕਤੀ ਨੂੰ ਨਿਸ਼ਾਨਾ ਬਣਾ ਕੇ ਕੀਤੀ ਗਈ ਸੀ। ਵੈਨਕੂਵਰ ਪੁਲਿਸ ਵਿਭਾਗ ਨੇ ਪੀੜਿਤ ਦੀ ਪਛਾਣ ਬਾਰੇ ਕੋਈ ਵੇਰਵਾ ਜਾਰੀ ਨਹੀਂ ਕੀਤਾ ਹੈ, ਪਰ ਕਿਹਾ ਹੈ ਕਿ ਜਾਂਚਕਰਤਾਵਾਂ ਦਾ ਮੰਨਣਾ ਹੈ ਕਿ ਗੋਲੀਬਾਰੀ ਨਿਸ਼ਾਨਾ ਬਣਾ ਕੇ ਕੀਤੀ ਗਈ ਸੀ। ਫਿਲਹਾਲ ਇਸ ਮਾਮਲੇ ਵਿੱਚ ਅਜੇ ਤੱਕ ਕੋਈ ਗ੍ਰਿਫਤਾਰੀ ਨਹੀਂ ਹੋ ਪਾਈ ਹੈ।
I believe it was hotel staff that found him. Yeah, there is a history with him with this lifestyle, but to say if he's an active member right now of what is going on, that's something we are looking into. It always poses the risk of a retaliation, and that's where the public safety does come into risk, as there always could be innocent bystanders. This whole picture paints the scene of a hallmark targeted gang-style shooting, right? So it fits that umbrella.
ਐਡਮਿੰਟਨ ਵਿੱਚ ਕੋਵਿਡ ਕਾਰਨ ਹਾਲਾਤ ਬੱਤਰ ਬਣ ਗਏ ਨੇ। ਆਈਸੀਯੂ ਵਿੱਚ ਅਨੇਕਾਂ ਨੌਜਵਾਨ ਇਸ ਵਾਇਰਸ ਕਾਰਨ ਜ਼ਿੰਦਗੀ ਅਤੇ ਮੌਤ ਨਾਲ ਲੜਾਈ ਲੜ ਰਹੇ ਨੇ। ਇੱਥੋਂ ਤੱਕ ਕਿ ਹਸਪਤਾਲਾਂ ਵਿੱਚ ਬੈੱਡਾਂ ਦੀ ਵੀ ਘਾਟ ਪਾਈ ਗਈ ਹੈ। ਇਸ ਕਾਰਨ ਅਲਬਰਟਾ ਸਰਕਾਰ ਦੂਜੀ ਪ੍ਰੋਵਿੰਸਾਂ ਤੋਂ ਮਦਦ ਦੀ ਗੁਹਾਰ ਲਗਾ ਰਹੀ ਹੈ। ਇਨ ਹਾਲਾਤਾਂ ਸੰਬੰਧੀ ਡਾਕਟਰ ਡਾਰਨ ਮਾਕਲੈਂਡ ਨੇ ਆਪਣੀ ਜਾਣਕਾਰੀ ਸਾਂਝੀ ਕੀਤੀ ਹੈ।
Political theater. This is the same man who called me a Twitter doctor, who looked at people with expertise and denigrated us, who basically took any criticism and demonized those people, and that's what he did so that he could open this up so he could have his stampede. We've been launched into space. We're still accelerating. Even if we apply all of these measures, it's going to take 2 weeks for us to see these numbers start to plateau. Meanwhile, our intensive care unit is full. It is fuller than it has ever been. And it is full of young people who are literally dying as a result of this. And we've lost the moderate middle. These people are truly shocked when they find out that they have COVID. They can't understand why they are sick. And they replace the empathy that we saw in the first wave with anger and confusion. This is even discounting some of the numbers that never make it to the unit. I was in the middle of the emergency department the other day resuscitating a young woman who was a single mother of 3 children, and she didn't even make it to the unit. These people are dying in the community undocumented. This is a tragedy that was completely preventable. Every time I'm here, I say the same thing. The medicine here isn't hard. The politics is difficult, but with leadership, we can avoid it. We're talking about transporting people to other provinces, medevacing them, distributing them possibly to Calgary, where our numbers are a little lower, and maybe further afield. But there are stresses in the rest of the country. You'd have to look at Ontario and BC. That is a challenging thing, to transport a patient that sick for that distance. That has huge risks associated with it. In the interim, we're discussing triage. We literally are talking about what happens when we hit these numbers, because we don't physically have the staff to look after the crazy number of numbers that are coming at us. I think if you know me, or I entered this field with my heart open to try to give people an inside look at the intensive care unit, because quite clearly the media is not allowed to see the things that we see, and that, I think, is now a problem. As a result, the narrative has changed. The stories are different, and people honestly believe that this isn't a problem because we've had political factions form. I've been the victim of death threats over this. We've seen our hospital protested by people who call us fascists and Nazis, and this is not where we ever started. I never thought we would get here. I truly believe that the majority of Albertans are good and honest and kind people. But when the minority controls the majority through lawlessness, that...
ਤੇ ਉਧਰ ਸਸਕੈਚੁਅਨ ਦੇ ਪ੍ਰੀਮੀਅਰ ਸਕਾਟ ਮੋ ਨੇ ਕੋਵਿਡ ਦੇ ਵੱਧ ਰਹੇ ਪ੍ਰਭਾਵ ਤੋਂ ਵੱਧ ਸਖਤ ਫੈਸਲੇ ਲਏ ਨੇ। ਇਸ ਵਿੱਚ ਉਹਨਾਂ ਮਾਸਕ ਅਤੇ ਵੈਕਸੀਨੇਸ਼ਨ ਨੂੰ ਲਾਜ਼ਮੀ ਕਰ ਦਿੱਤਾ ਹੈ। ਹੁਕਮਾਂ ਮੁਤਾਬਿਕ ਹੁਣ ਗੈਦਰਿੰਗ ਵਾਲੀ ਥਾਂ ਤੇ ਮਾਸਕ ਅਤੇ ਵੈਕਸੀਨੇਸ਼ਨ ਸੰਬੰਧੀ ਸਬੂਤ ਵਿਖਾਉਣੇ ਪੈਣਗੇ। ਇਸ ਮੌਕੇ ਪ੍ਰੀਮੀਅਰ ਨੇ ਉਹਨਾਂ ਲੋਕਾਂ ਨੂੰ ਵੈਕਸੀਨ ਲਗਵਾਉਣ ਲਈ ਵੀ ਬੇਨਤੀ ਕੀਤੀ ਹੈ ਜਿਨ੍ਹਾਂ ਨੇ ਹੁਣ ਤੱਕ ਟੀਕਾਕਰਨ ਨਹੀਂ ਕਰਵਾਇਆ।
Hello, Saskatchewan. For the past several months, you have heard me repeat a very simple message over and over. Get vaccinated. And the vast majority of Saskatchewan people have done their part. Unfortunately, today we are faced with a fourth wave, resulting in increased case numbers and a significant capacity pressure in our healthcare system, which is close to exceeding what we have faced before. But unlike previous waves, this wave of the pandemic is being driven almost entirely by one group that consists of about 20 to 30% of our population, those that have made the choice to remain unvaccinated. New cases are overwhelmingly in unvaccinated people. Hospitalizations are overwhelmingly unvaccinated people. The evidence from the data that we have seen is quite clear. As a province and as a government, we have been very patient, possibly too patient. The time for patience is now over. The choice to not get vaccinated is not just affecting you. It is now seriously impacting those who did do the right thing. And it is now seriously impacting those who cannot get vaccinated, our children. And it is prolonging the pandemic for everyone. The choice to not get vaccinated is creating consequences for others, and I would say very soon it is going to create consequences for those who have made the decision to remain unvaccinated. Later today, along with Dr. Shahab, I will be announcing further measures targeted at reducing the pressure on our healthcare system, targeted at increasing our vaccination rates, and making it less comfortable to remain unvaccinated in Saskatchewan. Effective September the 17th, we will be introducing an interim mandatory masking order. It will be applicable in all public indoor spaces. The order is targeted to be lifted in late October, at which time a full proof of vaccination will be, or negative test policy, will have been implemented for about 3 to 4 weeks. The proof of vaccination or negative test policy will come into effect October the 1st, and it will apply to several businesses, establishments, and event venues, while excluding several services that are necessary for every citizen in the province to access. We'll be releasing a full list later today. We'll also be announcing that all employees of the Government of Saskatchewan ministries, crowns, and agencies will be required to get vaccinated. With proof of full vaccination required by October the 1st, employees will be required to provide consistent proof of negative test if they are unable to provide their proof of vaccination. These aren't measures that we have wanted to implement, and as a government we have been patient in providing the opportunity and the access to get vaccinated. But that patience has now come to an end. The vast majority of Saskatchewan people have done the right thing, and they are growing tired of the reckless decision of the unvaccinated that is now driving our fourth wave. And Saskatchewan won't wait for you as we continue to move forward.
ਕੈਨੇਡਾ ਵਿੱਚ ਕੋਵਿਡ-19 ਨਾਲ ਸੰਬੰਧਿਤ ਮਾਮਲਿਆਂ ਵਿੱਚ ਤੇਜ਼ੀ ਨਾਲ ਵਾਧਾ ਹੋ ਰਿਹਾ ਤੇ ਕੈਨੇਡਾ ਵਿੱਚ 3955 ਨਵੇਂ ਕੋਵਿਡ-19 ਕੇਸ ਸਾਹਮਣੇ ਆਏ ਨੇ। ਇਸ ਨਾਲ ਇੱਥੇ ਕੁੱਲ ਮਾਮਲਿਆਂ ਦੀ ਗਿਣਤੀ 1.55 ਮਿਲੀਅਨ ਪਾਰ ਕਰ ਚੁੱਕੀ ਹੈ। ਕੋਵਿਡ ਇਨਫੈਕਸ਼ਨ ਨਾਲ ਕੈਨੇਡਾ ਵਿੱਚ ਹੁਣ ਤੱਕ 27,262 ਲੋਕਾਂ ਦੀ ਮੌਤ ਹੋ ਚੁੱਕੀ ਹੈ। ਸਥਾਨਕ ਮੀਡੀਆ ਨੇ ਜਾਣਕਾਰੀ ਦਿੱਤੀ ਹੈ ਕਿ 1 ਸਤੰਬਰ ਨੂੰ ਕੈਨੇਡਾ ਦੇ ਕੁੱਲ ਕੋਵਿਡ-19 ਕੇਸ 1.5 ਮਿਲੀਅਨ ਨੂੰ ਪਾਰ ਕਰ ਗਏ। इस दौरान 4.4 मिलियन की आबादी वाले अल्बर्टा सूबे विच मंगलवार को 1434 नवे केस और 9 मौतां दर्ज कीतियां गईयां ने। समाचार एजेंसी शिंजुआ की रिपोर्ट मुताबिक सूबे विच हुण 18,265 एक्टिव मामले और आईसीयू विच दाखिल 212 मरीजों समेत 822 हस्पताल विच दाखिल ने। अल्बर्टा की मुख्य सेहत अधिकारी दीना हिंशा ने ट्वीटर से कहा कि आईसीयू विच दाखिल 90% तो वध मरीज जां तां बिना टीकाकरण जां अंशक तौर पर टीकाकरण वाले ने। गल करिए अफगानिस्तान विच तालिबान के कब्जे की, जिस विच तालिबान वालों लगातार हिंसक वारदातां जारी ने, तां हुण तालिबान खिलाफ आवाज बुलंद की जा रही है। इस क्रम विच यूएसए के 4 संसद मैंबरां ने विदेश मंत्री एंटनी ब्लिंकन नूं एक पत्र लिखिआ, जिस विच उन्होंने अपील की है कि तालिबान नूं अतवादी संगठन करार दिता जाए। ये 4 संसद मैंबर ने रिक स्कॉट, डैन सल्वन, टॉमी ट्यूबिले और जानी के अंसर। ब्लिंकन नूं लिखे चिट्ठी विच अंसर और उन्हां दे सहयोगियों ने लिखा है कि अफगानिस्तान से फिर तो कंट्रोल करन वालों तालिबान ने मुड़ तो जानलेवा और दमनकारी नीतियां अपना लिया ने। तालिबान ने हक्कानी नेटवर्क के नेता और अमरीकी नागरिकों के कतल लई FBI वालों वांटेड अतवादी सिराजुद्दीन हक्कानी नूं कैबिनेट मंत्री के रूप में नियुक्त किया है। अतवादी संगठनों नूं सरकार में शामिल होने की आग्ञा दी है। संसद मैंबरां ने इस नाल यह भी मांग की है कि अफगानिस्तान की तालिबान अगवाई वाली सरकार नूं मानता देने वाले देशों खिलाफ भी पाबंदी लगाई जाए। फिलहाल वर्ल्ड न्यूज़ खबरों के इस बुलेटिन च इन्ना ही। देश दुनिया की बाकी खबरों की जानकारी तुसीं बने रहो साडे नाल चढ़ीका टाइम टीवी ते। धन्यवाद।